Hi, I'm Dr. David Cross, and I'd like to tell you about a type of medication that I sometimes prescribe for my patients with COPD, steroids. What happens with COPD is that there is chronic inflammation throughout your airways that causes the walls of the airways to swell, narrowing their opening and making it harder to breathe. Inhaled corticosteroids, or steroids for short, are used to reduce the swelling in your airways to prevent your symptoms from getting worse. I generally use inhaled corticosteroids along with a bronchodilator medication. There are some products on the market that combine an inhaled steroid with a long-acting bronchodilator in one product. One thing you need to remember with inhaled steroids is that it's important to rinse your mouth, gargle, and spit after using it. Now here are some examples of inhaled corticosteroids. Fluticasone, which you may know as the branded agent Flovent. Budesonide, which you may know as Pulmicort. Triamcinolone, known as Asmacort. Beclomethasone, known as Qvar HFA. Mometasone, known as Asmanex. Flunisolide, known as Aerobid. The combination of fluticasone and the long-acting beta-2 agonist salmeterol, which is the branded agent Advair, and the combination of budesonide and the long-acting beta-2 agonist formoterol, which is the branded agent Symbicort. In some cases, I may prescribe oral steroids in place of or in addition to inhaled steroids for a patient. An example of an oral steroid is prednisone. The problem with oral steroids is that because you take them by mouth, they affect your entire body and have more side effects. Don't worry, these are not the same as the anabolic steroids that athletes sometimes use. Additionally, to minimize side effects, most oral steroids are prescribed to be taken only for short durations of 5 to 14 days and not for long periods of time. If you have been prescribed an oral steroid, it's important that you only take it when your symptoms are getting worse, and only after talking with your doctor or care manager.